We can start, James.
Okay. So, welcome everybody to this today's session on Matters Health Association. We appreciate your presence. We thank you for taking the time to attend this session. I appreciate the fact that you may have other things that you may have wanted to do. You may have other agendas or tasks that you may have wanted to attend to, but you took the time to actually attend this session. So for that, I am truly grateful, and we do not take for granted your presence. Continue to be with us. We have a YouTube channel, a very young YouTube channel that is currently ongoing, still under Matters Health Association. So you can look for us under Matters Health Association. Um, if in case you miss or you would want to review some of the videos that or sessions that we have created previously, that we have engaged previously, you may go there and review them. Uh, still under still under Facebook. We have a group on Matters Health Association. Young as it is, you may find us on YouTube, on Facebook, and try and increase the popularity of it. Yes, so otherwise, my name is James. I'll be moderating for today. Unfortunately, Daktari will not be there for this session. However, we have a very able facilitator today, who is not a visitor and has been with us for a while. So I just want to take this opportunity. Today we will be discussing diabetes. I'm sure it may have affected you in one way or the other, directly or indirectly. So feel free to open up and ask questions and share your experiences, and let's educate each other. We are actually, iron sharpens iron. So we're going to educate each other, take this opportunity to educate each other. This is what the forums are all about: engaging and actually educating each other. The small that you know, the little that I know, we share and we make something big. So without further ado, I would like to welcome Douglas Maura today. Um, Douglas will be our facilitator for today. He'll be taking us through diabetes. Yes, and he'll tell us more about it. So, Douglas, please take it away.
Okay, thank you very much, James. Let me first by introducing myself. My name is Douglas Wamwire, and I'm one of the founder members of Matters Health Association. Because matters to do with health, I'm very passionate about them. And they say that wealth is health. Well, health is wealth. We know that a number of people have used a lot of money, that is their wealth, to treat their health. So when we have good health, we are able to accumulate also wealth, and it's for our good well-being. Without much ado, I like to state like what my brother said, James. I am not a doctor, but I'm also a diabetic patient, and therefore I believe by the time we are through with this session, because we won't be through today, I'll give my personal experience. So let me first start by giving facts about diabetes statistics. According to the World Health Organization, there are about 422 million people worldwide living with diabetes. Unfortunately, every year we lose 1.5 million directly attributed to diabetes complications every year. That's a very sad state. And yes, We're also going to look about these few topics, subtopics. First of all, what is diabetes? How many types of diabetes are there? What causes diabetes? And what are symptoms of diabetes? How do you control and manage diabetes? What are complications of diabetes? And last but not the least, how do you prevent stroke minimize risk of getting diabetes? Yes, Daktari will not be with us today due to unavoidable circumstances, but since this is a process we have started today, he'll be joining us and we shall hear more from him also. Him being a doctor, mine being an experience as a patient. Let us first ask ourselves, what is diabetes mellitus? What are the origins? Diabetes mellitus come from two words of Greek and Latin. Diabetes in Greek means to siphon. What is to siphon? Diabetes is excessive urination. Water passes through the body of a person with diabetes from the mouth through the urinary system and out of the body. What is mellitus? Mellitus in Latin means sweet like honey. The urine of a person with diabetes contain extra sugar, which is referred as glucose. It means sweet like honey. Let me also state that anyone can get diabetes. Anyone can get diabetes. And what is a simple definition of diabetes? Diabetes is described as a chronic condition of impaired carbohydrate utilization caused by an absolute or relative deficiency of insulin. I think it is important that we know what is the role of insulin in the body. Insulin is a hormone produced in the pancreas to regulate the amount of sugar in the blood. In person with diabetes, the pancreas produces no insulin, too little insulin to control blood sugar, or defective insulin. Here we find three issues about insulin: no insulin, too little insulin, or defective insulin. You need to understand more about how insulin works in your body, or rather in our body. You find me talking more of you. Think of each of the billions of cells in your body as a tiny machine, because our bodies are comprised of billions and billions of cells. Like all machines, cells need fuel. The food you eat are made of carbohydrates, proteins, vitamins, and fats, which are broken down to provide fuel for the cells. The main fuel used by the cells is called glucose, or a simple sugar. Glucose is a simple sugar. Glucose enters your body through receptors. Receptors are sites on cells that accept insulin and allow glucose to enter. I'll explain a bit later. Once inside, glucose can be used as fuel, but glucose has difficulty entering your cells without insulin. Now, I explain a bit. Let us think of insulin as a funnel that allows glucose, that is sugar, to pass through the receptor into your cells. If Let us take insulin as a funnel. We all remember when we go to a petrol station, to buy paraffin, we normally go with a container, which is mostly a plastic container or a bottle. And on top of the bottle, the petrol station attendant put a funnel so that that funnel allows the paraffin to enter into the bottle. So let us take the bottle as a cell, and the top of the bottle to be the receptors, to be the sites, okay? And the funnel to be the insulin, and the paraffin to be the glucose. Why do they put the funnel? They put the funnel to avoid the petrol from spilling into the ground, the paraffin. So insulin act like a funnel. It is the one that enables glucose to enter into the cells, and then cells produces energy for the body. Excess glucose is stored in the liver and muscle in a form called glycogen. Between meals, when your blood sugar is low and your cells need fuels, the liver glycogen is released to form glucose. Okay, let us look at the pancreas, the islets of Langerhans and beta cells. The pancreas is located in the abdomen behind the stomach. It is attached to the small intestine and the spleen. Inside the pancreas are small clusters of cells called islets of Langerhans. Within the islets are beta cells which produces insulin. In people who do not have diabetes, glucose in the blood stimulates production of insulin in the beta cells. Beta cells measure blood glucose levels constantly and deliver the required amount of insulin to funnel glucose into cells. They keep blood sugar in the normal range of 3.3 to 6.7 mOs, though that range keep on changing with time as per the World Health Organization. Now it's not 3.3, it's 3.9. Up to there, I think we are doing so far so good. Okay, when there is little or no insulin in the body, or when insulin is not working properly, glucose has difficulty entering your cells. Also, when there is not enough insulin, excess glucose cannot be stored in the liver and muscles tissues. Instead, glucose accumulates in your blood. The high concentration of glucose in the blood is called hyperglycemia or high blood sugar. I think I've explained why the sugars are normally high. The sugars are normally high in the blood. It is when there is not enough insulin, excess glucose cannot be stored in the liver and muscles tissue. So instead, they keep on accumulating in our blood. Before I come to a small break, I would like to ask ourselves, where does blood sugar come from? We have a backup source of sugar to use when we are not eating. You know, some people say they are not going to eat so that they can reduce the blood sugar. That to me is a myth. In most cases, the blood sugar will still be high. How? The main source is the liver. It is a big factory that makes many of the things that we need to live. One of these things is blood sugar. During the day, when we are eating, the liver puts some sugar into storage in form of glycogen. During the night, when we are asleep and not eating, the liver puts that sugar into the blood. It is converted from glycogen to glucose. If we skip breakfast, which most of us are fond of, but it's not advisable, the liver may actually make new sugar for us to use. It makes this new sugar from proteins that are taken away from our muscles. The sugar that comes from the liver and to a small degree from our kidney too explain why persons with diabetes can have a high blood sugar even when they are not eating. I think I've explained what I had said. Why the solution of reducing blood sugar is not in skipping meals. I think so far so good. I have explained what is diabetes. I've also explained the role of insulin, the pancreas, the glucose, and the cells. So maybe before I proceed, we can have comments or views or questions, and I'll answer questions according to my ability. It's an open forum now.
Wow, Douglas, thank you for that first session. That's absolutely awesome. I want to take this opportunity to continue welcoming to welcome